My dear viewers, welcome to yet another Doctor in the House program. But today, of course, it's not a medical program of its usual nature. Today, we are blessed and we are very fortunate to have in the studios of IBN two very senior specialists in the field of urology, and you would be introduced to them shortly. But let me greet you with Assalamu alaikum. May the peace and blessings of God be on all of us. My name is Firoz Abdul. Just for those viewers who've joined the program today, I know that after my last program with Dr. Gertz on this program, many of you have given feedback and said that the question of prostate disease is such a common problem that we need to talk about it more often. And guess what? Today we're not just talking about the everyday run-of-the-mill treatment, but we're very fortunate in Trinidad to have a specialist of the highest possible caliber from the developed countries coming to share with us up-to-date knowledge and information about modern treatment for prostate disease. Not cancer. We're not talking about cancer today. We're talking about benign prostatic hyperplasia, which is non-cancer of the prostate, and for the treatment of stone, which you would hear is a very common disorder in Trinidad and Tobago. Now, I want at the very beginning of this program to say thank you to many individuals and persons and beings for making this program possible. And so we start off by thanking God, through whose grace and mercy we are able to assemble here and you in the comforts of the home to look at this program and to disseminate this important information and knowledge. We want to also welcome and thank the specialist who is from Canada, Dr. Elmanzi, who is here, and he would be introduced in more detail. He has left his family and his kith and kin way in Canada to come here. So we really need to show appreciation for his being here. To the management and staff, Inshan and his people at IBN, to give us this important time. I know that television time is very, very expensive time. So we want to thank him, his staff, the manager and others, including Dr. Juman and his colleagues who have foregone their program today to facilitate and accommodate this program. I also want to thank Mr. Wazir Mohammed, who is the CEO of Clintech and Company Limited, the people who have facilitated Trinidad and Tobago with this up-to-date form of equipment that we'll be discussing more in detail, because had it not been for him taking the chance of getting our people to invest in this equipment, we would not be privileged to offer our patient the highest, most modern form of treatment for benign prostatic hyperplasia, or BPH as you would call it. I also want to take opportunity to thank Dr. Anirudh Mahabir, the owner and CEO of SurgiMed, and his people who have invested very heavily in this up-to-date. And I must tell you that he has spearheaded the English-speaking Caribbean in purchasing this equipment so that our people can benefit from the most modern equipment for the treatment of BPH. And I think we really need to give him a nice round of applause in your homes, thanking him so very generously for facilitating Trinidad and Tobago or the citizens for the surgery, which now offers our citizens many advantages over what we use currently. Now, as we move to the program, I want to introduce the two people. First of all, there is Dr. Lester Gertz. He is no stranger to this studio. Dr. Gertz is a senior consultant, has been senior consultant, Department of Urology for many years. He is a senior lecturer in Department of University of West Indies, doing lectures as he prepares urologists, and also as an examiner for the final urology exam. Dr. Gertz practices out of Medical Associate and Coral Drive Medical Center. He indeed is someone who has always been in the forefront of introducing new ideas, new concepts, and new technology for urologists throughout the Caribbean, along with his colleagues, himself, Dr. Rampal, Dr. Badrangi, Dr. Ramsubag, and certainly Dr. Philip Yongji, who would appear later in this program. So, you know, Dr. Gertz, let me first of all welcome you and thank you for joining us this evening.
Thank you for having us.
And Dr. Gertz, without further ado, let's introduce our very special guest. Please, would you do us the favor?
Yes, we are very fortunate to have Dr. Elmanzi, who is all the way from Canada. He's an assistant professor at the Northern Ontario School of Medicine, and he has had great experience in using this laser machine for prostates as well as for stones. And we're really happy for him to come to Trinidad and train us in the use of this equipment. And this training program, as you heard earlier, is taking place at SurgiMed Clinic under the guise of Dr. Anirudh Mahabir. And a number of urologists have been coming and getting that oversight that we desperately need from the experts to bring us up to par with the rest of the world. And I really have to thank him for taking the time and the effort. And I watched at how patient he is and how clearly he explains the technique of this procedure, which has made it much clearer in my minds and in the minds of the other urologists, and watching his skill and how he goes about it and assisting us in the learning process. I want to thank you very much for coming to Trinidad and sharing your skill and your knowledge.
Thank you so much.
So welcome.
Thank you so much for the invitation. This is my first time in Trinidad, and I really enjoy everyone's hospitality, and I hope for more to come soon.
Very much. So what you have really, from your introductory comments, said, Dr. Gertz, is that Dr. Anirudh and his organization has invested very heavily in very expensive equipment. But this equipment would serve little purpose unless we train people who are going to use the equipment, yeah?
Correct.
Okay. And this training is taking place currently at SurgiMed.
Yes.
Has been a training program a few weeks ago, and now continuation of the program.
Yes.
Under the watchful eyes of our specialists.
Very good.
Right. So, Dr. Gertz, you know, I am told that we're going to have a lot of new viewers on this station tonight looking at the show. So would you give us just a very brief summary of the prostate gland, what it is, where it is, and what is its primary function?
Well, quite simply, the prostate is a reproductive organ. It's important for you to have children. It produces the discharge, the ejaculate that allows the sperm to swim so that you can achieve a pregnancy. So it's really for reproduction. It's located just under the bladder, but we could only feel it, we can't see it, by putting a finger into the back passage and palpating it to find out if it has any hard nodules or any irregular areas that are suspicious for cancer.
Okay. So, Dr. Emilsey, you've been invited here to assist in the training and preparation of our people using this expensive equipment. Tell us, when you were invited, what is the purpose, was explained to you, of your visit to Trinidad?
Well, I had a very good communication with the urologist here and with Mr. Wazir as well, who invited me about the possibility of using the advancement in laser technology here and apply it to our community here in Trinidad, which makes me really excited about it, and sharing my knowledge in laser technology in both benign prostate disease, as you mentioned, and different kind of stones, which I think it went so far excellent.
Okay. So that this new technology that you talk about, when we in Trinidad, something new might be not so new abroad.
Yeah.
How new is this technology in the developed countries of the world?
Well, I mean, if we are talking about, we divided into two technologies, the one that we used for laser surgery, which we call it HOLIP, or holmium laser enucleation of the prostate. Well, it's now, in most of the countries all over the world, there is certain urologists who are able to do that. My understanding here in Trinidad, we are aiming for the future to start having more cases and more teaching about this holmium laser enucleation of the prostate. If we're talking about the other modality, which is SurgiMed had the device for MOSIS technology, which is recent advancement in using laser energy in more efficient way using, as I mentioned, MOSIS technology. It allows to deliver energy in more efficient way. That will result in less migration during the stone, more fragmentation, less OR time, hopefully more stone-free rates. This is really new technology that recently applied all over the world.
Okay, thank you very much. Dr. Gertz.
I would like to support that because I was very impressed because this is such a powerful laser. It's 120 watts, 25 watts, which is much more powerful than the ones we have in Trinidad, which is 20 watts. This is over 100 watts.
Okay.
So therefore, the stones fragment much faster you know, and that means there's less time in the operating room. That means you could do many more cases for a particular period of time. This would reduce the waiting list for patients waiting for surgery. And this is very important for the government, who has a great initiative to try and reduce the time patients are waiting for their procedures. So if the procedure is shorter, you could do larger stones in a shorter period of time. This would have a great impact for the government of Trinidad and Tobago to invest in this type of equipment to reduce the waiting list and to reduce the morbidity, because a lot of patients who would have had surgery, whether percutaneous surgery or open surgery, many times now, the larger stones that would not have been amenable to the smaller powered laser, with this powerful laser, they can now shatter the bigger stones.
So, Dr. Gertz, just to understand clearly, the modalities or the methods of treating benign prostatic hyperplasia, non-cancer of the prostate, at this point in time is essentially what? And what are the major downfalls or pitfalls of this form of treatment that is available?
Well, what we have presently, and it's important to know that we've looked at the figures for prostate cancer and benign disease. Now, this laser is not for cancer. Although prostate cancer is the most common cancer, accounting for 20%, followed by breast cancer in Trinidad, which is 15%, and colon at 10%, prostate still going at 20%. This condition, which is the enlarged prostate without any cancer, is even more common than prostate cancer in Trinidad. And this is called BPH, or benign enlargement. So it's a very, very common. In fact, it's so common that they've had a dedicated clinic only for BPH at San Fernando Hospital right now. So it's extremely common, and this is where this equipment becomes useful, because this is a common problem. Every family practitioner would have met somebody, many people with this condition. And what we do today, we offer, at least for this laser, it's useful for the very large prostates, those especially over 80 cc's, quite big glands. And we have used tablets, what we call 5-ARIs, to shrink the gland. But one must remember that's a slow process, and it does shrink about 25 to 29% within a 6 to 9 month period. But it doesn't shrink any further than that. That's where it goes. And you have to stay on these tablets. When you stop the tablets, it grows back. So you have to stay on it for life.
Okay, so
this is an opportunity that such patients who can't pass urine at all, or who have real trouble passing urine, can get a procedure that is bloodless. You know, so it's especially like yesterday, you did a case of somebody, because of their religion, they could not have blood, and they had a huge prostate that normally would have bled a lot. This patient was offered this procedure and was successful without any bleeding whatsoever.
So, Professor Elmanzi, you have to select your patients, because not all BPH would require this form of treatment or may benefit from it, right? What are the criteria that you would use in selecting the patients who would benefit from this type of surgery?
Well, that's a very good question. I mean, according to the American Urological Association guidelines, we know that HOLIP, or holmium laser enucleation of the prostate, is size independent. I can use it for any size prostate gland, but the real advantage comes when the prostate is very large, like I mean by large, more than 80 gram. Less than 80 gram, we can offer the patient any other forms of laser, but in my opinion, the big advantage for holmium laser, the technique, the enucleation technique, comes when the prostate more than 80 gram. Because it's part of the minimally invasive surgery as well. But again, if we would like to talk about minimally invasive surgery, we should consider the retreatment rate, meaning how frequent this patient may require another surgery for the same disease in future. With HOLIP, the patient far less likely will need any other surgery in futures. So, because we really remove the prostate gland that enlarged with age, and the size of the glands now comes back to his original size before the age of 50. So durability here is very important factor, and this is one of the lessons would like to talk about it. Like, it's, you know, one-day surgery, which is an advantage like any other technique. But the most important thing is the durability. This patient is not going to have another surgery for the same disease in future.
Okay. Now, when one talks about the treatment of patients with BPH, which is what we're talking about, one talks about a group of patients who are senior in age and so on.
Yeah.
In terms of this procedure, how long would it take a patient to have this procedure in theater? Is it a shorter duration or longer duration than the patient would require for a surgical procedure?
Yeah, that's an excellent question. Again, it depends on his prostate size. The 200-gram prostate, like yesterday, it took like almost 3 hours. If his 80-gram gonna take like an hour, so it's always related to the size of his prostate. When the size is bigger, it takes longer. But again, it's really it's a bloodless field, no blood, no need for blood transfusion. Even my patient next day after the surgery don't need any painkillers, early return to work, faster recovery time, which has really a big advantage.
You had, if I hear you right, said it's a one-day procedure.
Yes, it is one-day procedure.
So the patient goes home the same day, all being well?
So most of my patients go home the same day with or without a catheter, but if the prostate, with larger gland prostate, sometimes I keep them overnight and they take the catheter out in early morning and he's able to go home without the catheter. And again, this less hospital stay, less cost for the patient. If we're talking about like the traditional methods, when we do like larger cuts, when we deal with larger glands, patients sometimes stay in the hospital 5 to 7 days, risk of blood transfusion, catheter for 7 days. Again, we should put into consideration how early he's gonna go back to his normal life. It's one of the factors we need to consider as well when we talk about recent technology.
So when we talk about convalescence, the patient getting mobilized and so on, the patient can return to work if that required, or normal activities sooner than before.
Exactly.
So this is a tremendous saving, not only to the patient and the family, but in terms of government as well, because government is looking at how long the patient stays in bed. That's a cost to the government and a cost to the state, yeah?
That's correct, 100%, yes.
So we are talking about this procedure, this HoLEP machine.
Yeah.
Could you explain for our viewers who are not as smart as Dr. Goetz exactly what this HoLEP means?
So HoLEP stands for holmium laser enucleation of the prostate. Simply, if you think about large prostate or the super glands prostate size, if you think about it, it's like an orange, has fruit inside and there's a skin or cover outside. What HoLEP does by certain techniques and energy, it peel off this fruit and push it inside the bladder, and with another machine called morcellator, it cut this prostate tissue in small pieces and cut it out, and we leave only the cover or the skin of the orange, which represents the prostate size when he was like teenager or something. So again, the advantage, less hospital stay, less bleeding. If the patient, some of our senior patients, they are on blood thinners and they cannot stop their blood thinners, I'm comfortable doing HoLEP on them, without any need for blood transfusion.
So in terms of post-operative follow-up, traditionally when patients have surgery, they would be followed up, I would imagine, pretty often.
Yeah.
What about with this procedure? How often would they need to come to the clinics, for example, for revisitation of the doctor?
So number one, if the patient has a catheter overnight, I take the catheter out. I always tell my patient, take it easy, no lifting heavy objects for around 4 weeks, no sexual intercourse for 4 weeks, and he can still, do his office work and go to his normal activity. And I usually like to see my patient in 4 weeks to check on him, everything is going well, and I see him after that every 1 year to examine his prostate and to do blood test, which is PSA. And remember, when we do HoLEP surgery, still there is a tiny prostate left and the patient is still at risk of prostate cancer. So I don't want people or my patients think we remove all the prostate, we are not targeting here prostate cancer disease, we are targeting benign disease. You're still gonna have tiny prostate, and you should be in contact with urology at least once per year to check your PSA blood test.
And that is the same for all treatments for benign disease. Even if you did a TURP, you did a Millen's prostatectomy, or any prostate procedure for benign disease, that does not prevent prostate cancer from developing at a later stage, and they need to have follow-up to check and make sure this doesn't happen.
So, Dr. Gertz, the first of its kind in the English-speaking Caribbean,
I would
thanks
think so.
to
Anirudh.
Dr. Anirudh Mahabe and Surgical in San Fernando. We are now privileged to have this, right? And it's a very costly piece of equipment, I understand. We have spoken of some of the advantages offered to the patient. What about the risk of infection that is involved, and how do we manage this? Do we give the patient, for example, pre-operative antibiotic, Dr. Gertz, from your experience?
You know, we tend to do that routinely. There are patients who come who have had a catheter in. Many of these patients who have tubes in have organisms there, and you don't want to introduce an instrument and flare up any infection. Even if there's no catheter in, we are putting in an instrument, and we'd like to prevent infection. And many times we give them what you call prophylaxis or preventative antibiotics at the time of surgery. You know,
Professor, would you give the patient antibiotics after the procedure, and for how long?
Yeah, that's a very good question. I mean, I got trained by a lot of my teachers, some of them. So we all of us like give antibiotic perioperative, like intravenous. But there is a debate about giving antibiotic for 7 days after or not to give. I always give antibiotics for 7 days after my surgery.
Okay, my dear viewers, here on IBN, thanks to the courtesy of Inshan and his team, we are privileged to be discussing this very up-to-date, this modern form of equipment purchased by Surgimed in San Fernando through its director and CEO, Dr. Anirudh Mahabe, brought here through the courtesy of Clintech Company Limited. We will take a very short break, and when we return, we will certainly continue our discussion. I want to tell you, of course, later in the program, we'll open up the lines so that you too, the viewers, would have an opportunity to ring the program and ask questions, hopefully relating to the subject being discussed today, which is BPH, or non-cancer of the prostate gland. So please stay right there.
Need medical assistance? Come check us out at Ultimate Medical Clinic. We offer a wide variety of medical treatments. Why live in pain and suffer with wounds and ulcers?
Ultimate Medical Clinic also provides laser therapy for pain relief and wound healing.
We also treat arthritis, knee, neck pains, diabetic neuropathy, diabetic foot sores, psoriasis, eczema, and many more health conditions. Call us today to schedule your appointment, 665-1188, or visit us at 111A John Street, Montrose, Chaguanas.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
My dear viewers, welcome once more to this program on IBN. It replaces Doctor in the House program. We are thankful to Dr. Juman and his team for allowing us and for accommodating us to run this program. Courtesy of Dr. Anirudh Mahabir and his team at Surgimed, and certainly of Wazir Mohammed of Clinitech Company Limited. These are the people who have made it possible for us to have this modern form of treatment of BPH or non-cancer of the prostate gland. So please continue to be with us, and I thank you always for your support of the programming at IBN. We need to talk a little bit, Dr. Almanzi. I asked you earlier on how you select these patients, right?
Yep.
Of course, I suspect that in treating a patient for BPH, you would want to rule out the existence of cancer.
Correct.
So maybe Dr. Gertz can share with us what is done in order to ensure that we know that we're dealing with very precisely BPH and not cancer, or BPH and cancer. We're talking about enlarged prostate, right?
Yes,
so Dr. Gertz, how we go ahead doing this?
But certainly, first to say it is BPH, and that's the fear we have in Trinidad. Everybody talks about this enlarged prostate, but the fear is that there could be a cancer.
Right.
Although the last study we did over 500 patients, the majority did not have an enlarged prostate. The patients with cancer had normal size or small prostate. So enlarged does not necessarily mean cancer, but we do have to rule out a cancer because the cancer treatment is different. Where this laser machine is shelling out the prostate and leaving back the capsule, if it's a cancer operation, we have to also take the capsule, what we call a radical prostate. We can't leave back the capsule because that's where the cancer tends to be. But this, for enlarged prostate with no cancer, you can core out the prostate or shell it out or enucleate it, which is what this luminous laser is doing, and it's a very powerful laser. To make sure you don't have a cancer, there are the two things you really need. You need your PSA, which is your blood test, the prostate-specific antigen, and that should be within the normal range, or you need to have a normal prostate. So if you have an abnormal prostate on the finger examination, or you have an abnormal PSA, then that becomes suspicious. It doesn't have to necessarily be both the PSA and the rectal. It could be either or it could be both. And an abnormal rectal would be a nodule, something hard sticking out, or the prostate may not even have a nodule, but it feels harder. Like we say that if you feel like your forehead, it's a cancer, but it feels like the nose and more spongy, it's benign. So the hardness can tell you the nodularity, the irregularity on the finger, not the size. Any size can get cancer, big, small, medium. It is how it feels, the consistency and the surface of the prostate, as well as the blood test, which is the PSA. And we put the two together and say, okay, blood test is normal, prostate feels normal. That's just an enlarged prostate. There's no cancer. We can go ahead and use this laser operation.
Dr. Almanzi, is it a prerequisite to the procedure that you rule out the coexistence of a fulminating infection at the time of surgery?
That as a routine for most of the procedure in urology especially, like we need to have test called urine culture. We take a urine sample to make sure there is no infection, and if there is any infection, we treat our patient with antibiotic for 7 days and we repeat the culture. Usually we take the patient to the operating room, culture or infection free. If the patient has catheter, for example, we give him prophylactic antibiotic by mouth. This reduces the risk of infection.
Okay. Do you routinely recommend antibiotics during the surgical procedure?
It's always preoperative antibiotic. Around the time of the surgery, we give antibiotic intravenous. This is by guidelines 100%, yes.
So it's still working during the operation. Even though we give it just before the operation, it is working while you are operating.
Okay. Dr. Almanzi, you have been here now a few days, right?
Yes.
Doing this procedure.
Yeah.
Can I ask you to be honest to us?
Sure.
And tell us how would you evaluate the quality and caliber of our urologists in terms of being able to assimilate and absorb, taking this technical information in your short spell here?
I will be honest with you. From what I have seen, let me tell you, I was like really surprised about. You cannot really find, easily like 5 urologists really interested, and they provide their time to be available for this training. But I really found them here. I really found they are very eager to learn, and I feel Surgeon Med Center with this 5 urologists going to be the center for HOLIP in the future, because the most important thing to acquire new technology is to be persistent and the follow-up. And I really enjoy the attitude. They are, I mean, I was here to share my knowledge. I mean, I learned a lot from them as well, you know, and I feel like they have better understanding. We have lectures in the morning. We show some videos. They have great ability to ask questions, and I was really excited and amazed by their attitude and their understanding of this challenging procedure, like we call it, HOLIP.
Okay, so Dr. Ilmanzi, the thing is that the guys are here ready, willing, and able to absorb, assimilate, and to use the knowledge in the technical sense.
Yes.
Is this a one-stop training program that when you return to Canada that they would be competent and able to operate on their patients? Or is it an ongoing process? And if so, how long? Is there a number of hours, or how would you evaluate the doctor's readiness
Yes.
to undertake this procedure on his or own?
Yeah, so I mean, we know all the publication about HOLIP. It's a little bit challenging procedure, has a steep learning curve. So in my opinion, like one visit will be enough. So I think we have a plan that we will have frequent visit. I'm thinking about, 20 cases total per surgeon until he's comfortable. And once coming in future, in my visit, find that the surgeon here or the urologist is able to continue all the steps without any interference. So I'm done, and I will say goodbye to the group and maybe just visiting family in the future only.
So, well, that's very encouraging. So you were saying when you are satisfied that a doctor is able to undertake this very technical procedure on his or own, without much supervision or any supervision from you again?
Yes.
Right.
Correct.
Is there certification of the doctors when you are satisfied that he or she is able to practice independently? In other words, do you certify them from your board that you come from, the hospital that you represent, or the university? Should there be some form of certification that this doctor has, in your view, met the requirements that you can say that you verify this person is now competent to practice?
Well, there is no really certification from my side, but the real certification is, surgery is done in the right way, and next day in the morning the patient is able to void. And I think we will be in contact through emails and through phone calls if there is any challenges or any different like difficulties they face. They're gonna be like, we're gonna have like some communications, but there is no really formal certificate. The real certificate is patient satisfaction and their satisfaction there. They feel comfortable doing the procedure. And again, the 20 procedures or the surgeries, in my opinion, is just a start. We still, all of us have some challenges during the cases, and we will able, to manage it as well.
Do you see down the road, in future, that would be a need to have the trainers program, to have doctors here who can do precisely what you're doing and train the new urologists to do this procedure?
Exactly. I think this will be just a start with this 5 great urologists, and they believe, and I'm sure in future they will try to distribute HOLIP technology, different hospitals to the public. They will have a training program as well. I think our young urologists or the residents should be exposed to this new technology as well, including HOLIP or MOSIS technology. I believe this is the right way to go, and this is going to be the good start at SurgiMed first.
Okay. Have you made any new friends here, and have they taken you out to visit the countryside or eat what we call doubles?
Well, I think we're so busy doing a lot of challenging cases. I have a lot of friends now. I think next time maybe we'll have more time for visit, but we were really busy the last 3 days, and I was very, very happy about it. Like, we have very good results, patient satisfaction great, and I really like the attitude of everyone here. It's like feels like a family.
So your visit is going to be well worth it.
For
every
sure.
minute of the time, yeah?
I will come with my family next time.
Oh, we look forward to that and to act as hosts for them.
Thank you.
Right. So, my dear viewers, we are privileged today to have Dr. Gertz and his colleague from the Canada coming to talk about the introduction of this new technology, thanks to the courtesy of Wazir Mohammed of Clintech Company Limited, right here in Trinidad, who has really brought this specialist to help our doctors to develop the requisite skill in order to use the machinery, which of course is purchased a very expensive machine through Dr. Anirudh Mahabir and Surgimed. I mean, I don't consider it a risk, but to invest money in a difficult economic time, he has to really be very smart and very brave. But Dr. Anirudh is known to be that kind of person.
Yes, I agree with you, because I had a very nice discussion with him, and I was really, amazed about the attitude when he said, education is number one, and other factors comes, at the end. So this is the vision that we need. We cannot start anything alone, but I found a lot of people here have a very good vision, which is the most important factor. Without vision, this project is not going to continue.
And whatever we do as doctors has to really accrue benefits to the patient at the end of the day, yeah?
That's correct. I agree with you, yeah.
And if this technology offers a simpler procedure, as you said, bloodless surgery, only a few years ago we were talking about a bloodless prostatectomy, Dr. Gertz, remember?
That's right.
We had the guys from all over the world coming and training our doctors. Today we
Correct.
can talk about removal of BPH through a bloodless procedure.
Correct.
Correct.
Yeah?
Yes.
And there are some patients, as Dr. Gertz alluded earlier on, who by virtue of their faith or religion will not accept blood. So that this procedure is a significant advantage to them.
Correct. Yes.
Also, you may have patients who require blood transfusion, but their level of hemoglobin may just be adequate to do this procedure without transfusion necessarily.
Yes, that's correct. Yeah.
Okay. My dear viewers, we have these two goodly gentlemen on the studio, thanks to Anirudh Mahabir and his people, and of course, Wazir Mohammed from Clintech. We are talking about this new technology which they have brought into this country, and they have brought, of course, the specialist, the man who now goes across the globe teaching doctors the same thing he's doing here. He was one of the first person in Canada to have introduced the technique, and so we are really privileged to have him here. We're going to take another short break, and when we come back, we'll continue our discussion. But don't forget, we have Dr. Ayong Chi will appear on the program during the latter part of the program, and we'll open up the lines to you. So please stay right where you are.
Need medical assistance? Come check us out at Ultimate Medical Clinic. We offer a wide variety of medical treatments. Why live in pain and suffer with wounds and ulcers?
Ultimate Medical Clinic also provides laser therapy for pain relief and wound healing.
We also treat arthritis, knee, neck pains, diabetic neuropathy, diabetic foot sores, psoriasis, eczema, and many more health conditions. Call us today to schedule your appointment, 665-1188, or visit us at 111A John Street, Montrose, Chaguanas.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
My dear viewers, thank you for sitting there in the comforts of your home and certainly benefiting from this very educational program talking about the introduction of this very special, highly specialized laser treatment of BPH or non-cancer of the prostate gland. And we have Dr. Gertz with us, well known in Trinidad and Tobago, and of Dr. Almanzi, who is a specialist from Canada coming to teach our doctors how to use this equipment to get maximum benefit, minimal possible side effects and so on. So I think that you will be enjoying this program as I'm certainly doing, thanks to the courtesy of Wazir Mohammed from Clintek and Dr. Anirudh Mahabir from Surgimed. They're the ones who've brought the technology to Trinidad and Tobago. Now, Dr. Almanzi, I just want to correct something I said over there because of enthusiasm and perhaps over-enthusiasm. I said you were the first in Canada to have introduced it. It's really not Canada per se, but Ontario, which is a huge province anyway. Certainly much bigger than 10 times Trinidad, right?
Yeah, this technology was introduced by Dr. El-Hilali, you know, I think in 2000. He's the first person who performed this HOLIP in Canada.
Yeah. And Dr. Gertz, I know that over the years, you and your team of doctors have been very instrumental in getting some of the latest technology in South. The envy of the Caribbean. I know we in Trinidad, we have everything we need when the money was flowing like water. Unfortunately, we don't have money flowing like water anymore. And so we have the problem. Thanks through the work you guys have done, you've been able to get this service also in the hospital. Now, for members of the government party or those with power should understand that this kind of technology can certainly give much benefit to the hospital setting as well.
Yes.
Because certainly the waiting list that exists right now, I know it's one of the largest lists of all different types of surgery because of the absence of adequate number of anesthetists, for example, in the hospital situation. So I know that it will certainly reduce the waiting time for patients in the hospital setting. And certainly it's for those who can make the effort and sacrifice and have it done privately. We now know that in the Caribbean we are spearheaded by Surgimed that offers this procedure, right? So let's talk a little bit now about other things that this equipment can do apart from treating a large prostate. It can also, it's very versatile. It can treat smaller. Is there a different procedure that you would use to treat smaller prostates?
Well, again, we said HOLIP or holmium laser enucleation is size independent. We can use it for a small gland or large gland, but with 120 watt machine, which is a machine has MOSIS technology. I mean, with certain buttons, you can just, you know, ask the machine to do certain tasks. So for less than 80 gram prostate, I use the 120 watt energy with the holmium laser to just vaporize the prostate, you know, which give me in this size gland the same effect like a holmium laser enucleation of the prostate. But once the gland is larger than 80 gram, I always do holmium laser enucleation of the prostate. And one of the unique advantage of this machine, including MOSIS technology, is sometimes we go inside, we are aiming to treat prostate, and we found some huge bladder stones. We are not gonna stop here or just to choose, are we gonna treat the prostate or treat bladder stones only? With the same machine, we can do both at the same time. Sometimes you can find the strictures. You can deal with it at the same time, which is advantage for holmium laser over different kind of lasers.
For the benefit of our viewers who don't understand what a stricture is, would you care to explain?
Yeah, just narrowing in your urinary passages or the urethra due to previous infection, previous catheter, or previous surgery, which need laser technology to cut this scar tissues, like we said, and we have normal opening back.
Okay, so you are treating any coexisting problems that the patient may come to you with?
Under the same setting in the OR.
Okay, so I know one of your specialist areas is really talking about the prevention, the treatment and management of kidney stones or stones.
Correct.
Would you care to give our viewers a very brief summary of what is required in the prevention of kidney stones?
Well, number one, we always advise the patient to drink a lot of water, like at least 2 or 2.5 liters per day. This is one of the most important factors. If the patient has previous history of stones. Stone analysis is very important because, as you know, there's different kinds of stones, and some of them related to diet or related to medication. So when you do the stone analysis, we can give the patient better understanding about how to prevent future attacks of stones, to avoid certain diets or certain wrong behavior. But if I'm going to give one piece of advice, is increase water intake. 2 or 2.5 liter per day is a very good preventive measures.
That shouldn't be so difficult in our very humid climate, right?
Sometimes it's difficult for some patients, but I mean, if you form a stone, you need to choose between having pain and emergency visits frequently, or you drink 2.5 liter. I think it's a good deal.
Well, I must say from the advice you've given, I'm reassured because that's what our doctors locally have been encouraging our patients over the many years. So they're right on track.
Yeah, that's perfect.
All right. So my dear viewers, here we are on IBN talking about this new technology, courtesy Wazir Mohammed of Clintech and Surgimed through the courtesy of its owner, Dr. Anirudh Mahabir. We are talking about how do you manage BPH or non-cancer of the prostate gland. What we would like to do at this point in time is to take a short break and invite Dr. Ayong Chi in our studio to join us as we continue our discussion. And after that, we certainly will open up the line to invite your questions. So please stay right where you are.
Great unbeatable prices from Extra Foods. Minced chicken per pound, $19.95. Fine choice chicken breast, $15.95 per pack. Perdix chicken nuggets, 300 gram, $19.95. Happy oil, 1.5 liters, $17.50. Oasis water per case, 5 for $95. Ibis flour, 2 kilogram, $11. Happy macaroni, 800 gram, $7.95. Fruta, 1 liter, $8.50. Add Kellogg's Unicorn cereal, 19 ounce, $29.95. Only at Extra Foods, Endeavor, Grand Bazaar, Arima, and Chitwanis Main Road. Extra Foods, always something extra for you.
Keep refreshed with Oasis Premium Purified Water. Now available in more thirst-quenching options. 330 ml, 600 ml, 1.5 liter, and 5 liters. Choose the size that fits you best. Grab one today.
IBN can be viewed on the go now with the Airlink TV app for Google devices. Simply go to the Google Play Store, search for the Airlink TV app. Download the app, click on the link and fill out the form. The account activation will be emailed or texted to the user. It's safe as no credit card is needed. The first 30 days are free and you can subscribe and receive a box for your TV to stream the same content.
Medical assistance? Come check us out at Ultimate Medical Clinic. We offer a wide variety of medical treatments. Why live in pain and suffer with wounds and ulcers?
Ultimate Medical Clinic also provides laser therapy for pain relief and wound healing.
We also treat arthritis, knee, neck pains, diabetic neuropathy, diabetic foot sores, psoriasis, eczema, and many more health conditions. Call us today to schedule your appointment, 665-1188, or visit us at 111 A John Street, Montrose, Chaguanas.
My dear friends, welcome to the other part of the program, Doctor in the House. But today it's not Doctor in the House, it's let's talk about the most modern way of treating benign prostatic hyperplasia, or BPH as we all call it. And present, we continue with Dr. Imanzi, who is the specialist urologist from Canada, who is the man who is training and teaching our doctors this particular procedure using the up-to-date equipment, most modern there is in the world, I understand, through the courtesy of Wazir Mohammed from Cleantech Company Limited, and through the generosity and kindness of Dr. Anirudh Mahabir from SurgiMed in the Southland. And of course, in the studio now, as I promised you throughout the program, is Dr. Philip Ayongchi. And Dr. Ayongchi is no stranger to me because he has been in South many years. That's where he got his formal training, and he is now a senior consultant urologist at Mount Hope Hospital, and he's in private practice at SurgiMed in San Fernando. So Dr. Ayongchi, welcome to the program.
Thank you very much.
Now, Dr. Ayongchi, I know that you were one of the 5 persons that Dr. Imanzi has been talking about receiving the prerequisite training so that you would be able to, on your own, do this procedure to the benefit of our patients in Trinidad and Tobago. If I could ask kindly, how do you evaluate this training program? First of all, how would you say was preparation and so on to receive him, and the preparation of theater and the atmosphere in which he has to do this training, because those things are relevant, right? If the atmosphere is not pleasant, if there's not adequate preparation, then his training becomes difficult. Your reception of the training material becomes difficult as well. So share with us your experience in this particular way, Dr. Ayongchi.
Well, Dr. Imanzi is, what I would say, a very good teacher. I mean, he was very patient with us. He's very passionate. I mean, you should see how he energizes the theater itself. You understand? The preparation basically was that we had a run before. My advantage also was that I also attended a course in England. And so I knew part of what is required. And Dr. Imanzi communicated with us, informed us what we need to do. Of course, every surgeon has their own techniques.
For sure.
So I've seen 3 techniques now. And I say we're still in the evaluation phase. His technique is a nice technique. It's more like what we call the open surgery technique. So most of us are comfortable with the open surgery technique. Only this time we are using a machine and a laser instead of a finger. So he assisted us, he guided us through, he was very patient with us, made sure that we understand what was going on, and when we made mistakes, or we tended to veer off the course, he was there to immediately correct us. Right? So we were able to do the surgeries and comfortably finish.
How would you say, as a person and a very senior urologist, you are finding your assimilation, absorption of this information? Was it easy for you?
Well, all information takes time to assimilate.
Right.
Okay? And with our experience, we are aware of different techniques.
Right.
This is just another new technique that we have to learn and adapt to.
Okay.
Right? So it's adding on to our previous knowledge. Right? The advantage of this technique, as Dr. Imanzi said, is that we don't require blood transfusion, which is a big problem in Trinidad and Tobago. So if you can get away from the blood transfusion, I think patients will be happier. The second thing is that patients are not going to get a cut. So there's a next day home.
Right.
And the advantage of next day home without a catheter.
Sure.
Which is a big advantage.
Sure.
So you're looking at less time in hospital. But of course, technology has its price.
Sure, of course. Dr. Ayongchi, talking about transfusion, would you say, based on your experience, as I know it happens at San Fernando occasionally, patients' surgery have had to be put off because of not having blood available, either donors or the wrong group or whatever it is?
Well, we are aware that we don't have a proper blood banking system.
Yeah.
And patients have to donate their blood before they can be booked for the surgery. But there's not a guarantee on the day of surgery that blood will be available.
Yeah.
So if we can have a system whereby we can say, listen, your surgery is tomorrow, and come out to me, it's going to be done tomorrow, regardless, because we don't need blood.
Yeah.
So once the patient is prepared, the surgery is definite. Right now, the patient is prepared, they've made their blood donors, we have cross-matched the blood, and we're ready for theater, and something happened last night, blood has disappeared, surgery is cancelled. In this case, surgery is definite once planned.
How do you, as a senior experienced surgeon in urology, see this affecting the waiting list for patients requiring this type of procedure, removal of the benign prostatic disease?
Well, it's going to save us a lot of time. One is that we don't really have the bed capacity. All right, so a patient come in one day, can come in on the morning of the surgery. And depending on if they're done early in the morning, they can go in the afternoon, so then no bed is used. Okay? Or the patient go the next day. As opposed to what takes place now, the patient is in hospital for at least a week.
Yeah.
So it is a lot of thing. I mean, and as you said, we need to thank Dr. Marbia for actually investing in this technology, which will take us to the forefront now, first world standards.
So, Dr. Ilmanzi, one of the problems we have in Trinidad and Tobago, and I suppose in some ways my experience it's a worldwide problem, is getting men to come out and be screened. And the usual fear is that most men who are not very well educated about their bodies and so on associate the prostate with their sexuality and so on. Is there an association between this procedure and erectile dysfunction?
Well, that's a very good question, and there is a common misconception that prostate or laser surgery or HOLIP might affect erection. There is no relation at all. It's not going to affect the erection. If you have very good sexual life before the surgery, it will remain the same after the surgery. But it will affect your ability to have ejaculation. You still will feel the orgasm, but you are not going to have any ejaculation. And some data, recent data shows even sometimes after HOLIP, patient has improvement in their erection simply because they stop the medication for the prostate enlargement that caused some problem with the erection.
All right.
But for sure you will lose your ability to ejaculate, but you're still going to feel the orgasm.
But,
of course.
But would you, I think patients will be more comfortable because they're now passing urine better, right?
Yeah.
And the added advantage that if the ejaculate is going backwards into the bladder, then their chances of fertility, of having another child is zero. So basically they'll be happier and freer.
Exactly.
And of course, and for those with a very large obstructive prostate who have a catheter, there will be no use for this catheter, which could be very embarrassing for patients, huh?
Well, exactly. It's not really practical. We have, like we did yesterday, a case that has a catheter for 1 year, and it was a very challenging, and his prostate was almost 200 grams, and I believe it went well, and this morning he was able to go back to his normal voiding function or normal urine function.
Very good. My dear operators, my technicians, can you open up the lines so that our viewers on this program can call us and ask us their questions relevant, hopefully, to this topic on today's discussion, which is the advancement in the treatment of non-cancer of the prostate gland. So your numbers are there, my dear viewers. Here you have your opportunity to ask questions. We have Dr. Yongchi, a very senior urologist, and Dr. Imanzi, who is from Canada, sharing information with us on helping our doctors to train to the required standard necessary to undertake this procedure. Courtesy Dr. Anirudh Mahabir, Surgimed, and Mr. Mohammed of Clinil Apps. So we'll wait for the calls. Meanwhile, while we're waiting, let me ask you, Dr. Imanzi, in terms of the treatment using this particular machinery, can we treat other conditions in addition to those that we mentioned, for example, BPH and stone disease, and correction of any form of scar tissue we have?
Yeah, I mean, we can use the holmium laser in treating stones, as we mentioned, different.
Could I interrupt you? And this is inevitable, eh?
Sure.
Let's take this first caller, please. Hello, welcome to the program.
Yes, gentlemen, my goodly doctors, the specialists that are there.
Hi, good day.
I myself am a specialist, but I'm a specialist in producing stones. I have had 3 surgeries for kidney stone. In 1980, Dr. Yip Hoy did mine at Vista Bella Nursing Home. I had 10 stones at that time. In 1995,
Sir, could I interrupt you for a moment?
Yes.
We'd appreciate very much if you don't necessarily mention the name of your doctors or the centers
right.
where you had your treatment.
no problem.
Let's keep it anonymous, but you could share the experience, okay?
Yeah.
Go ahead.
Then in 1995, I had 14 stones removed again, one left side, one right side. And then back in 2010, I had another 14 stone removed again for my left side kidney. So, and then I also had stone removed from my salivary gland. So the doctors told me that my body is producing too much calcium. You know, but I am not a person that drink enough water. So that is one of my downfalls. But over a period of, 15 years, I had 3 and 4 surgery concerning stone. Now, as the doctor rightly said that you're supposed to drink 2.5 liters of water daily, which I can safely say I don't do. But I have tried it, and I hope that it will continue. I'm now 73 years of age. So I've had 4 at that type of surgery for stone in my kidney, and also I still have the stones after 15 years. They have not melted. They are still there. So
Okay, sir.
I just say, let me share
Is
this
there
so
a
that,
specific question you like to ask us, or should I hand it over to Dr. Yongchi to reiterate what you should do?
Well, I will prefer to listen to you all now. I just lay my thing like a personal
Thank you very much indeed, sir. Appreciate that.
Period of time.
Dr.
Okay,
Yongchi,
all
what
the
advice
best.
would you give the caller?
Well, he is producing a lot of stones. The question now is that has he had a metabolic workup to see whether there's a cause for the stone formation?
All right.
Okay, and that he never really said
Okay.
that he had a workup. But definitely, yes, you need to drink fluids. You need to drink at least 3 liters of fluids a day.
Okay.
And for him making that amount of stones, it means that he needs to make at minimum 2 liters of urine a day. So it's not a matter how much he drinks, but how much urine he makes.
All
But
right.
definitely he needs to go back to his doctor and have a proper metabolic workup.
All right. Thank you very much indeed, Dr. Yongchi. Our next caller, please.
Hello?
Hello. Good night.
Yes, sir. I had my prostate done too, transuteral resection. Is that the same thing that the laser is doing? And since I've heard that she said that the machine is so expensive, with the cost for the poor man, will it be astronomical?
Dr. Ibanzi, he had a TERP from what I hear him say. Is this the same as what you are now proposing we introduce to Trinidad and Tobago?
No, it's completely different. TERP using the cautery or the electricity to just remove prostate tissue. And here we are using laser technology, so it's completely different.
And what's the advantage?
So the advantage, it depends on the size of the prostate. If his prostate originally was more than 80 gram or 100 gram, usually with TERP we have limited time that we need to finish as much as we can. So in large gland, most of the time there is some residual tissue that might obstruct the patient or block the patient in the future. With the laser technology, we have no time limit because it's very safe procedure. This is the main advantage, and the other advantage is less bleeding, less hospital stay, less catheter time.
There you are. Let's get the next call one time, please. Hello, welcome to the program.
Hi.
Hi.
Hi, good night.
Hi, good night.
Good night, ma'am.
Good night.
Hi. I'm calling concerning my 89-year-old father.
Yes, we can hear you. Go ahead.
Okay, he had prostate scraping done on 2 occasions in the past. But what the complaint he has now is that he has frequent trips to the bathroom, like about 4 or 5 times per night. Can this surgery assist him in any way?
Dr. Yongchi, based upon the education that you've been getting now and your vast experience, what would you suggest to the lady?
Well, my first concern is that he's 89 years old. And the question is that will he be able to withstand this surgery? And do you really want him to undertake this surgery at this time of his life? And that's the first thing you need to decide. Are you willing to take that risk? With regards to the surgery, whether you had TURP before, it's not a contraindication to stay away from the holmium laser surgery, because the TURP basically causes out the very center. It doesn't take out the whole prostate. Whereas the HOLEP, we go actually at the capsule to completely remove that inner tissue. So yes, it's possible, but for this patient at 89 years old, you have to seriously decide whether you want to put him through the trauma of this major surgery.
Dr. Emanzi, would you say that the age is the criteria or the quality of life of the patient, or both? I am asking.
So my experience is there is a lot of factors to consider here. My understanding, she has a previous, his father has a previous TURP. So I would scope this patient first to make sure there is no scar or a structural disease could be contributing to his symptoms. This is a very simple procedure under local anesthesia provided here in SurgiMed, and just to make sure there is no stricture. If there is no stricture or there is no scar and there is really residual tissue of the prostate, depending on his general condition, I have operated a 97 and 98-year-old gentleman, and he has a catheter for a year, and I explained to him, I counsel him about all the risks possible. If the patient is able to provide a consent and he's understanding, he will be at higher risk related to anesthesia and other things, and this is really affect his quality of life, well, I am happy to provide the surgery. I have done it before. So number one, we need the correct diagnosis by doing cystoscopy to exclude other disease. Number two, we need the patient to tell me that it really affects his quality of life. And number three, we need to make sure there is residual tissue, prostate tissue, that can, if can be removed, can improve his symptoms. That's very reasonable option, and we'll be very happy to provide that in near future.
Okay, thank you very much indeed. I think it's the final call. Hello, welcome to the program.
Yeah, I'm on the program. Waiting.
Hello, welcome to the program.
Hello.
Hi, we can hear you. Please chat with us.
All right. I am 75 years old, and I would like to get some advice. It is my understanding that you can remove your prostate. How long does something like this take, and what would be your advice at somebody at my age? And secondly, sometime when I go to urine, you know, it stops, and then all of a sudden it comes flowing. I try to drink as much water as I can and as much liquid. But I would really like to know, is it important to remove your prostate at this stage?
Dr. Yongchi, would you help the gentleman, 75 years old, and he has this problem?
Right, so I'm not too sure exactly what he is getting at. I mean, he first want to ask if the surgery is appropriate. Before you think about surgery, you need to make a diagnosis. So you need to see a urologist and be assessed on exactly what is his issue. Because he wasn't too sure exactly what problem he's having, but he did towards the end, he's having a problem of actively passing urine. Right? So regardless, you need to see a urologist to be properly assessed to decide what is the problem. And after investigation, then we can decide, you know, what is the appropriate treatment. And if it's an enlarged prostate, then we can consider holmium laser. But until that time, we can't. That's the first step.
Because as Dr. Gert said earlier on, we need to do, as Dr. Yongchi is saying, do an evaluation assessment if required, do some tests in order to establish, are we dealing with cancer, are we dealing with BPH, are we dealing with a chronic infection, a combination thereof.
That's right.
Right, so that, thank you very much indeed. So we've literally come to the end of the program, Dr. Yongchi and Dr. Emanzi. right? And I want to, on behalf of the people of Trinidad and Tobago, to thank all you goodly gentlemen for what you are doing. You are doing what we call here human service, educating our people so that they can take responsibility for themselves. The responsibility of my health is not my doctor's responsibility, it's my responsibility, but I also incorporate the advice and the professionalism of my doctor involved in my care, right? So I would like to thank again, as we started, to thank God for enabling us to be here. I want to thank IBN and in particular Anshan and his team, the manager who's been really on top of this interview today, and his team, to thank Dr. Anirudh Mahabir and Surgimed for facilitating this process of training and development and for purchasing what must be a very expensive equipment. But beyond that, for ensuring that the doctors in Trinidad and Tobago receive the prerequisite training in order that they can use this equipment to benefit our people, best result, minimal risks involved. I want to also thank this Wazir Mohammed from Clinitech, who has actually brought the idea of having this equipment in Trinidad and Tobago. So there are many, many persons and individuals we need to thank. And so, my dear friends, we've come to the end of the program, and I want to thank you, as always, for viewing IBN. Whatever the programming, I know you enjoy it. Dr. Juman has done a tremendous job in this Doctor in the House program because I get the feedback on the outside. And if there is anything new in urology or in medicine that I can bring to you again, please count on it. So until then, I greet you with Assalamu alaikum. May the peace and blessings of God be on all of us. Good night.